Hello and welcome to this presentation on what will it take to develop healthcare workers' confidence in AI. My name is Dr. Annabelle Painter and I'm the Chief Medical Officer at Visiba. But before I was at Visiba, I previously worked in the National Health System in the UK in their NHS AI lab. And my role there was looking at what factors influence healthcare workers' confidence in AI and how that could be bolstered through education and training. And as part of that, I authored these two white papers that you can see on the screen. The first of which delves into which factors contribute to healthcare workers' confidence, and the second, that point about education and training. And I'm going to talk you through some of the key findings from those reports today in this presentation. But first, just taking a step back, why were these papers commissioned in the first place? This is really about thinking about how we achieve AI at scale within any healthcare system. It's really important that we have a healthcare workforce that is confident in using AI, in procuring AI, in developing AI, in evaluating AI. And so we need to think carefully about what the key factors are that might be preventing that confidence and what we can do to overcome them. So let's get into it. So this is a diagram I think explains a lot of concerns when it comes to healthcare workers in relation to AI. This isn't from our paper, but it's from a paper that was published recently, and I think it's a really good representation of common concerns. I particularly like the way it's being shown as an iceberg here, because at the top of the iceberg you can see a lot of topics that you hear frequently when it comes to AI in healthcare that cause concern. So these are often things that relate to AI technology itself. So it's questions about safety and about bias, questions about the accuracy of AI tools, questions about whether they should be tested externally, and also the discussion about whether AI tools in healthcare need to be explainable. But beneath the surface of this iceberg, there are loads of other concerns. And actually, these concerns are often hidden from the dialogues that you hear about AI. And they're much more related to how AI is used in healthcare, how it's integrated into workflows, and the reality of actually using AI day to day in healthcare. And I think these are really important concerns that must be addressed. So these are questions, for example, about workflow and about workload, about the changes in the doctor-patient relationship, about liability, and about physician well-being. So when we did our research, we interviewed healthcare professionals, we interviewed academics, and we interviewed AI developers. And we came up with a framework to think about the key issues that are affecting healthcare workers' confidence. And we built them into this framework. So the framework consists of three main layers. The bottom layer is the most fundamental. And these are the features that really underpin healthcare workers' confidence in AI. And above that, so we have governance at the bottom layer, and above that we have implementation. And these come together in our framework, and they are displayed in the shape of an arrow. And the reason that they're in this shape is because in these fundamental layers, we really want to increase confidence in AI, and we want to do all we can to increase confidence in these factors. In the third layer, when we get to clinical decision-making, the situation's a little bit different, and I'll come to that later. The other important distinction here is that the bottom two layers, these apply to any AI that's used within healthcare. So it doesn't just apply to AI that's used in clinical decision-making in healthcare, whereas the top layer is specific to AI that's used in clinical decision-making. So let's get into the factors that comprise these layers. So let's start off with governance. There are four key features here, and arguably the most fundamental is about regulation and standards. When it comes to confidence in the healthcare AI workforce, the workforce want reassurance that the regulations that are in place ensure that products on the market are safe, they are effective, and they are fair. And there have been concerns that the regulations to date haven't really ensured these in the context of AI technologies. Now, of course, we've had new regulation that's come out recently in the EU with the EU AI Act, but there are ongoing concerns about how that interacts with existing regulation like EU MDR. And I think what that looks like practically for AI devices remains to be seen. So the next point is about evaluation and validation. So the healthcare workforce want reassurance that the AI tools that are on the market have the appropriate evidence to support their use. And what we heard is that the healthcare workforce want the evidence standards for these technologies to be equivalent to the evidence that's expected for other healthcare innovations. So for example, drugs and other therapeutics. But the challenge here is, how do we develop evaluation methodologies that are appropriate for digital health technologies? Because traditional evaluation frameworks, for example, using randomized controlled trials, often don't work for digital health technologies. And the reason for that is that digital health technologies often work partly because of the change in workflows and ways of working that come with them. And that can make it really difficult to tease out the impact of the digital health technology on its own. So we need to think about innovative ways of gaining this kind of validation and evaluation approval. And that needs to be able to move in step with technological innovation and with changing technologies. Part of that is opening up the potential for real-world evaluation and real-world evaluation frameworks. And I think what healthcare professionals would really like is specific guidance on what the evidence standards that they should be asking of AI developers, and also guidelines on how to conduct clinical evaluation and prospective clinical trials for these kind of AI technologies. So the next pillar here within governance is about guidelines. Clinical professionals will be most confident using AI when they have clear guidelines about how it should be used in clinical practice. In the same way that there are guidelines about how to treat certain conditions, when to do certain tests, and when to give certain medications. But alongside clinical guidelines, confidence can also be bolstered through guidelines for things like implementation, for design of AI, and for procurement of AI, so that healthcare professionals know the kind of questions they need to ask of AI innovators. The final pillar here is about liability. Healthcare professionals want to feel confident that they know where they stand in terms of accountability for AI. So what happens when an AI tool that's used to assist a clinician gives an incorrect suggestion and that clinician follows that advice? Will the clinician be liable for that decision? How does the liability sit between the clinician and the AI developer? What about in a situation where the clinician ignores the advice of that AI tool and the AI tool advice was correct? Will the clinician be held to account for not using their AI advice? All of these questions are very open at the moment. There is no case law for this, and it's causing a lot of anxiety and uncertainty amongst the clinical profession. So we need some clarity here on the liability situation in order to bolster confidence. Okay, so now we're going to move up to our next layer. So sitting above governance, we have the layer of implementation. And this is really about having confidence that within a healthcare system, there is the right structures, both in terms of people and teams, but also in terms of data and of technical infrastructure to allow AI to be deployed effectively. So if we talk first about strategy and culture, healthcare workers want to feel confident that the right strategic decisions are being made in relation to AI, and they want to make sure that this happens within a culture that supports innovation and collaboration. So in order to achieve this, we need to have leaders and managers who understand AI and have the right knowledge and expertise to be able to implement it appropriately. We also need them to be able to deliver this responsible innovation culture that allows for learning from mistakes and shared learning across the healthcare system. Technically, there needs to be confidence in the IT infrastructure within healthcare, and we've got a long way to go in order to achieve this. Personally, I work as a doctor in a leading teaching hospital in London, and frequently when I arrive at work, it takes me 15 minutes to log onto my computer. These kind of hardware frustrations within the healthcare workforce need to be overcome if we're going to have an infrastructure that can facilitate sophisticated AI technologies. Above that kind of basic digitalization, we also need to have things like interoperability standards. We need to have a data structure that allows for information exchange and quality data infrastructure. And we also ideally need platforms that allow for AI to be deployed across healthcare sites quickly so that bespoke deployment setups are not required. So local validation, I think, is an important topic that's also often under-discussed in this area. When AI technologies are developed, it's a requirement that they have appropriate evidence generated in order for them to get, for example, a CE mark. However, at that kind of general level of evidence often doesn't account for local variability in terms of deployment. And therefore, before AI technologies are deployed at a local level, it's important that those AI technologies are tested on local infrastructure. But this kind of local validation methodology requires having people with the technical skills in order to be able to do this at regional levels within healthcare. And this is going to need multidisciplinary teams with clinicians who have expertise in AI, linked with people with data skills and technical skills in order to be able to do this kind of validation. And the validation at this point is done before deployment, but we're also going to need to be doing ongoing evaluation of those AI technologies once deployed in that local setting to make sure that the AI is still performing at the expected level. And again, that's going to need ongoing resourcing and ongoing skills. So the final point here is about systems impact. And this is about the healthcare workforce wanting to feel confident that AI technologies are being deployed in a safe, efficient, and ethical manner, and that they are overall having a positive impact on the system, and that we have the appropriate metrics in place in order to assess this on an ongoing basis. Okay, so now moving on to our top layer. So this is about clinical use. And as I mentioned, this is slightly different to the bottom two layers. With governance and implementation, we really want to do all we can to increase confidence in the AI workforce by improving the areas we've already discussed in there. But when it comes to clinical use, we don't necessarily want healthcare professionals to increase their confidence in AI tools. Instead, what we want is to give them the ability to think critically about the AI tools they use, so that they can have a varying amount of confidence in AI tool output, depending on the situation in which it's being used. So for each clinical decision, they can calibrate their confidence appropriately, depending on the clinical scenario and depending on the tool they're using. So if you look at the diagram here, this is what this is trying to represent. So what we want is to have here this kind of level appropriate confidence throughout all decisions. We don't want to get to a situation where there's inappropriately high confidence, so we're trusting AI implicitly or when we shouldn't, or there's inappropriately low confidence where AI outputs are being rejected and not used when in fact they are correct and could be clinically useful. So I think another way that's useful to think about this is about this being a balance between different cognitive biases that we are all susceptible to. So if we think about an AI tool and how accurate it might be, if we think about one extreme, if that AI tool is 100% accurate all the time and it's a clinically assistive decision-making tool, a clinician will likely come to just accept that AI output regardless without questioning it and critiquing it. And therefore they'll be susceptible to automation bias, which is implicitly trusting an AI output. Now, in the context of an AI tool that's always right, that may well be appropriate. But in reality, AI tools are not always right. And it's actually highly unlikely that a tool will always be correct. So it's very important that clinicians retain their vigilance and their ability to critically appraise outputs of AI technology. But the better an AI tool is, the harder it is for that clinician to maintain that vigilance when they get so used to assuming that the answer is correct. On the other hand, imagine a situation where a clinical tool is often incorrect. In this scenario, the tendency for a clinician is to ignore the output because they don't trust it. But this can mean that important scenarios in which their tool is correct get ignored. And I think as healthcare professionals, we're all quite familiar with alert fatigue, with lots of pop-ups appearing on electronic health records, showing all sorts of warnings that generally we often ignore because it's so infrequent that they are actually correct. And actually, it seems like the percent of inaccuracy in these kind of pop-ups and these kind of warnings or alarms on systems that are used within healthcare is about 10%. So once there's a 10% error rate, clinicians often start ignoring these alarms. So there's a balance here to be struck. And as clinicians, we're probably going to be sitting somewhere between this balance of performance where There's less than 10% error rate, but it's less than 100%. And we need to try and build in ways that allow clinicians to maintain their vigilance and make sure they do pick up on the situations where AI is incorrect, because ultimately it's going to be the clinician who holds the responsibility for making that decision. So what can we do to try and bolster this? Well, there have been several things that have been tried and experimented with, and something that's often talked about is explainability. So if we can have an AI tool that explains its reasoning and how it gets to a given output, could that help clinicians to be able to critically appraise the output? Well, that has been tested. In this particular study, this was looking at radiologists interpreting mammography scans. And these radiologists were used to interpreting mammography scans, and they do that as part of their daily work. And they were asked to say whether they felt like there was a high risk of cancer in the scan or not. And they were shown outputs from an AI that did or did not contain explainability. So the AI said that it felt there was cancer or there wasn't cancer. Sometimes the explainability was a heat map, so it showed the scan and areas that it thought were high risk for cancer, and sometimes it showed that in combination with some other metrics about the patient in question. Now, what you can see on the screen here is the results from the radiologist. And what it shows is that when the AI correctly gives a suggestion, the performance of the radiologist is about 78% accuracy. However, when the AI gives an incorrect suggestion, that drops to 28% accuracy. And importantly, the presence or absence of explainability made no difference here in how likely it was that the clinicians were to follow the AI advice. So what this suggests is explainability is unlikely to be the answer to helping clinicians to avoid automation bias. And this also shows that clinicians do have a tendency to trust AI outputs and to be guided by those outputs, even if it steers them in an incorrect direction. So what can we do here? Well, we need to do more research into the clinical AI relationship and the psychology of clinical decision making. And we need to design AI products carefully, thinking about where in a clinical workflow we might show an AI output. Should we only show the AI decision, for example, after the clinician has already made their clinical judgment? And ultimately, we need to think carefully about the workflows in which AI is introduced and the impact that might have on clinician behavior. We need to think about scenarios in which clinicians might be more vulnerable to automation bias, whether that's based on their experience or even things such as their energy levels or the time of day. And we need to be cautious of that when introducing AI technologies. So there we have it. That is our framework for looking at confidence in AI in the workforce. So after we looked at this side of things, we then thought, well, what can we do in terms of education and training and workforce transformation to support this? So when it comes to education and training, we think of it in three main steps. The first step is that we need to make sure the healthcare workforce has basic digital literary skills. It's all very well talking about AI, but actually we need to make sure that the healthcare workforce has the ability to use basic digital infrastructure first. After that, we need to make sure that there is general AI education available to the whole healthcare workforce. And this should be freely and easily accessible to everyone. And importantly, this isn't just about training new healthcare workforce members, such as clinicians in training. This is about educating all the healthcare workforce across all areas and at all stages in their career. Then we need to give individuals bespoke education depending on their interaction with AI. And I'm going to come to more about that in the next slide. And finally, for each individual AI product that our healthcare workers use, they need to have bespoke training, and that product-specific training needs to cover how to use that AI tool safely, and importantly, where are the weaknesses and limitations of that AI tool, and where do they need to be using extra precautions? Okay, so I think when it comes to education and training the workforce, the tendency there often is to align educational needs with existing roles. So managers need to know this, doctors need to know that, nurses need to know this. But in reality, when it comes to AI use in healthcare, the interaction that individuals have with AI doesn't align with these traditional work roles. Instead, you might have a nurse who's a specialist in AI in their trust. You might have a manager who has very little to do with AI. You might have a doctor who has become an AI expert and is involved in creating AI algorithms. So rather than thinking about traditional job roles, when we thought about educating the workforce, we split them into 5 archetypes. And these archetypes represent an individual's involvement with AI. So the first of those archetypes are shapers. And these are individuals that set the direction for AI policy and governance, generally at a national level. The second group are drivers, and these people champion and lead AI deployment at a regional level. So they might be involved in, for example, procuring AI, commissioning AI, or leading an AI team in their trust or regional area. Next, we have the creators of AI. So these are individuals within the healthcare system who are involved in making AI algorithms, maybe bespoke in-house healthcare algorithms, or perhaps collaborating with industry to co-create algorithms. The next group are our embedders. So embedders work to implement and integrate AI into healthcare. And they are a mixed multidisciplinary group of individuals, often with technical and data skills. Finally, we have our users, and this is anyone in the healthcare workforce who's using any AI tool, so it really applies to anyone in the workforce. And it's worth noting that these archetypes are not necessarily mutually exclusive, and there may be individuals who wear multiple hats. However, most of the workforce will probably fall into one of these archetypes. So what we then did is marry up the requirements from education, from the framework that we were talking about earlier, with the archetypes to work out who needs to know what when it comes to AI technologies. And we came up with this framework here, which shows how much individuals need to know. And obviously some need to know more than others, and some in more detail than others. So our creator and embedder groups need to know a lot about AI across all domains, whereas users, they really need to specialize in thinking about the clinical use of AI and making sure that they are integrating AI appropriately into clinical decision-making, as we were discussing earlier. So the final thing to mention is that education alone cannot achieve confidence in the workforce. If we are going to build a workforce that's confident in using AI and building AI and procuring AI and implementing AI, we're going to need to change the way that we work as a workforce, and we're going to need to transform the workforce in terms of its composition, its skills, and its specialities. So this is going to involve new ways of working, new leadership roles, and new teams. And one thing in particular we feel is important is establishing multidisciplinary teams that specialize in AI at a regional level within healthcare. And these should be made up of clinicians who specialize in AI, but also data scientists and engineers, people involved in clinical safety and in governance. And those teams should work together to make sure that AI in a given area is implemented in the most safe and effective way. This is challenging because we're going to need to develop new roles, and we're going to need to bring new people and skills into the workforce that haven't been there before. And we're going to need to make sure that they have the right opportunities, the right career trajectories in place, and the right reimbursement available for their particular kind of skills. We also need to make sure there's appropriate buy-in from healthcare leadership to understand the value of people, these kind of skills, and make sure that they are championing them as well. So that brings me to the end of my presentation. If you would like to know more about the work that we did and understanding and developing healthcare workers' confidence in AI, then I would direct you to these 2 papers. Thank you for listening.